Hi everyone, this is Dr. Rich from the College of Brockport, and I'd like to talk to you about the cardiac cycle. You should recognize this slide, or these two panels, from the figure in your textbook, that really complicated figure that describes all aspects of the cardiac cycle. I think it's really important. So a cardiac cycle begins during atrial systole with one P wave in the electrocardiogram, and it goes all the way to the next P wave. So on this slide, it takes about 800 milliseconds. Now, when we start the cardiac cycle, we're in atrial systole. Then the atrium relaxes, and we start ventricular systole with the QRS complex. Notice that the ventricular systole begins really right in the middle of the QRS complex, and that's because those cardiac myocytes first depolarize, and calcium comes in during that plateau phase. So that's a few milliseconds after the beginning of the membrane depolarization in a cardiac myocyte. Okay, what I really want to talk about during this cardiac cycle is the left ventricular volume. Now I could label this right ventricular volume as well, because both sides of the heart pump identical volumes. What you can see is right here at time equals 0, at the beginning of atrial systole, the ventricular volume is filling. It's going up, correct? And what's happening here is the atria are contracting, and they're really pushing blood into the ventricle through the AV valve, in this case the mitral valve. Now, at point number 3, the atria are done contracting, and the ventricles begin to contract. We have ventricular systole. Notice that the volume is flat. That flat volume refers to isovolumetric contraction. It happens right at the beginning of ventricular systole. All 4 valves are closed. The AV valves have been pushed shut by the increased pressure in the ventricles, and the semilunar valve, in this case the aortic semilunar valve, has not opened. We're at end diastolic volume. Notice the end of ventricular diastole and end diastolic volume. Okay, now those ventricles contract, pressure increases very rapidly, and suddenly ventricular pressure exceeds aortic pressure, and therefore the aortic semilunar valve is pushed open, and we can see that stroke volume rapidly decreases. And in this case, we're going from 130 to 50 milliliters. That's an 80 milliliter stroke volume. That's typical. Now we're at end systolic volume. That's the amount of blood that's left in the heart at the end of contraction, at the end of ventricular systole. You can see that we've got roughly 50 milliliters left in that heart. And you should know that there's always blood left in the heart at the end of systole. If we increase contractility, for example, end systolic volume will decrease, and this number would go down to maybe 40 or 30 milliliters. Okay, end systolic volume, that's the amount of blood left in the heart and at the end of ventricular systole. And now notice we've got a flat line on this volume curve. So the left ventricular volume is constant for a short time at the end of ventricular systole and a little ways into ventricular diastole. So at the beginning of ventricular diastole, all 4 valves are shut. So once again, we've got isovolumetric relaxation because we're in dystole. So we've got at the beginning of ventricular systole, we have isovolumetric contraction, and down here we've got isovolumetric relaxation. End diastolic volume is the maximum volume of the left ventricle, and end systolic volume is the minimum volume. These are really important terms that you need to understand. And now last thing, notice that volume increases relatively slowly during ventricular diastole. That's passive filling of the left ventricle. And as we, in this amount of blood that's in the ventricle will change when we change heart rate. It doesn't change much if we increase heart rate from 72 beats per minute to 100 beats per minute. You can see we still have plenty of time for filling, but if we really decrease ventricular diastole that's the same as saying if we really increase heart rate, so 130, 160, 190 beats per minute, well now end diastolic volume is going to decrease because we don't have as much filling time. Okay everyone, good luck. Pay attention and know the definitions of stroke volume, EDV, and ESV, and really be able to relate those values to the cardiac cycle. I hope this is helpful. Bye-bye.